an average cost of the emergency room visit is, between $900 and $2,000, depending on the type of visit in the emergency room.
Just to walk in the door and sign in.
Right.
Hello, and thank you for joining us for another educational episode of Shot Callers. I am Carrie Bigford, the Outreach Director at Texans for Vaccine Choice, and today we have the great privilege of hearing from Christ Clinic's Executive Director, Laura Motz. Laura is a registered nurse and has been the Executive Director of Christ Clinic since 2017. And Christ Clinic itself is a wonderful local 501c3 nonprofit clinic that can provide the uninsured, underinsured, and their families with access to primary care and mental health counseling that they otherwise wouldn't be able to access or afford. Thank you so much for spending your time with us today, Laura. How are you?
I'm great. Thank you for having me. I'm excited to get the opportunity to talk today and share a little bit more about Christ Clinic and what we do.
Please share a little bit more about Christ Clinic and what you do.
So you did a great introduction. We're a charity medical clinic in Katy, and we exist to serve the patients that fall through the cracks of all of the other healthcare systems that are available. And one of the ways that we do that we're able to do that, is through volunteer physicians. So all of the physicians that we have are volunteers. And then we have a lot of other volunteer medical professionals as well. But we don't bill, and which means we don't bill Medicare or Medicaid or any other private insurance. And we're really the epitome of a grassroots organization. So everything we do is informed through our local needs. Our growth is very organic, and doctors get the opportunity to volunteer here and do the kind of medicine that they went to school to do.
That's wonderful. How was it for you guys during the lockdowns and the pandemic? I mean, how has it changed since 2020?
Oh, the pandemic was hard for us, for sure. Our patients were definitely disproportionately affected. I mean, the truth is the world was affected, right? Everybody was affected. Even people that had a safety net going into the pandemic many didn't as they came out of the pandemic. But for our patients, they already didn't have a safety net. So going into the pandemic and through the other side of it has been really challenging. And the same has been true for us, even from a fundraising standpoint. It's just been challenging because individuals are, feeling inflation and feeling changes in the economy. But we survived, and we continue to do what we can for our patients. And we had to pull back on volunteers for a little bit, which was challenging. But now we have more volunteers than ever and are consistently looking for more.
Did you have an opportunity to treat any patients during COVID? And if so, how did that work?
Oh, absolutely. Yeah, we treated a lot of patients during COVID, and we do the same thing other doctors' offices do as far as technology goes. So we have an EMR, and we were able to do telehealth visits and stuff like that. But, we also did a lot of inpatient visits. And one of the things that I found really interesting during the pandemic is, so I'm a nurse, as you said, and I'm definitely not trying to badmouth any healthcare systems. This was a new experience, and I hope we all learned from it. But one of the things that we saw as there was a lot of tunnel vision around the pandemic, and a lot of healthcare entities that kind of just forgot that there are other reasons that people are sick and other things that can happen to them. And so we had, a lot of patients that were sick with things other than COVID. And we had a hard time accessing the same resources that we were able to access before for our patients, because the world was kind of blinded by COVID, fear of COVID, effects of COVID. So we, felt even more alone than we always feel serving the population we serve. But it allowed our patients or our providers to do what they felt was best for the patient on an individual basis. So we are, you hear people say cookie cutter medicine, and we are the opposite of that. So it is very individualized, very much a relationship between the patient and the provider to do what is best for that patient based on their beliefs and wishes, and what the provider believes is best based on that patient's desires.
Do you think the healthcare field is still kind of suffering from the myopic consequences of that time, putting everything kind of off to the side, like COVID being the center of it all?
A little, I think, in a different way. It's almost like we're seeing the flip side of that, right? So it's like COVID is still in the focus, but now it's become like, oh gosh, there was such a need for COVID care, and all these other things were on the back burner. And now, because of COVID, we're forced to focus on these other things that were on the back burner, when realistically we should have figured out a better balance along the way.
I mean, if you could pick a different way for us to have responded to patients during that time, I mean, how, if you got to have a say in how we can handle something like this again, as we're getting that pre-frame for the next pandemic, how would you view that role as being different?
I mean, honestly, I think the biggest thing is, and if we ever come into another crisis like this again, and I hope we don't see it in our lifetime, but if we do, I think the biggest thing is going into it open-minded and being aware of how little we know, right? How little science there was, and how little resources there were, and how, as a charity clinic, we're used to doing things off-label or doing things in a roundabout kind of way because our patients can't access the standard of care or the most expensive resources that an insured population can. But just because they aren't the standard practice doesn't mean that they aren't good, and it certainly doesn't mean that they aren't better than nothing, right? Would be Absolutely. The alternative for many people. So right. I think we just need to go into situations like that a lot more open-minded and a lot less judgmental. And I think the biggest thing for the medical community too is stay true to who we are as a medical community and being backed by science, and try our best to stay out of the political conversations, because it hurts the trust that we've spent hundreds of years building with the patient population.
Agree. The lack of trust in the medical community at large is, I've never seen it quite like this before, and I've been a medical liberty advocate for many, many years. I mean, how do you see us making amends? I mean, there's so much mistrust. How can you help patients and doctors and nurse practitioners rediscover each other in that trust relationship?
I think our current healthcare model makes it challenging because it's so based on efficiency and scale, being able to scale medicine. And I think the only way that you rebuild trust, just like with anything else, is through relationships, right? And in order to have a relationship with our patients, then we've got to be able to have enough time to sit down with them and get to know them, and them get to know us, and know them bigger than just what's on the surface of their medical chart.
Right. They're more than their presenting symptomatology.
For sure. Yeah.
Right? So I know that Christ Clinic does a very good job of trying to educate their patients about, being an empowered, active participant in your healthcare role. Can you tell me more about how you ensure that the patients that come to see you are becoming active, participants in their own care?
Yeah. So again, serving the uninsured population, being able to access everything that, like, I as an insured patient have access to is just not possible. And frequently when people come to see us, they're in the worst situation in their life, right? They feel like they're at rock bottom, and their capacity for being able to problem solve or cope or learn, take in new knowledge is small, right? Mm-hmm. So when, for example, if a diabetic patient comes into us, we're able to prioritize conversations with the patient to help them understand, like, okay, like, yes, you have diabetes, and it's very important right now for us to get your blood sugar under control. Diabetes can affect these other things like your skin and your feet and your other organs, your heart and your kidneys. And those are all very important things. But then, looking to our patient to lead the pace at which we deal with those things. Because if we try to throw everything at them all at once, it's very hard to know what, even for me, right? As a healthcare professional going to the doctor, it's hard to leave and know, okay, which of those things was I really supposed to focus on? Which of those things are dire and which of them are like, would be good? And which of them was I told because you had to tell me? It's really hard to know the difference in those. And because we don't bill, we have more freedom to lengthen the amount of time it takes us to get from point A to point Z with a patient, and give it, deliver the information at a pace at which they can process it.
Right. Internalize it and apply it to their lives without being overwhelmed and in a freeze response because of it.
Yeah.
Right.
Yeah.
I mean, so since 2020, how has that experience changed, like the informed consent process, or how does someone like become a patient with Christ Clinic? Can anyone become a patient, or are there requirements to use this facility?
So there are requirements to use the facility, although we have a program that would allow anyone to be a patient at Christ Clinic. But for to be a charitable patient of ours, you have to be at 200% of the federal poverty level or less. And there's charts online that can show you that. But for a family of 4, it's around $55,000. And uninsured or underinsured, which would mean that your annual deductible would be 5% of your annual income or more. So for those patients, they become a charitable patient for us, and they're part of our total care program and get the full range of all of the services we have to offer, which is, primary care, specialty care, pharmacy, education, all of those things. For those patients, I think we have such good trust and rapport with our total care patients, and they've really been, their trust has been abused in a lot of different situations, whether it's, where they were from, or whether it's in a personal social history, right? Just like family dynamics, or in the medical community. I think a lot of times people think that just because someone is in poverty that they don't have the knowledge or education to be able to make the decision that is best for them. And we don't believe that. We believe that people should be able to make whatever decision is best for them, because, that's one of the things that makes America great, right? Freedom.
Yeah, absolutely. Well, and as the owner of your body, you should have a voice in that conversation.
Of course. Absolutely.
Yeah. Okay. So post-pandemic, have you noticed any changes in like diagnosis codes or any kind of evidence? Because it seems like everywhere I go, people are talking about more injured people from the vaccines, or they're having, more chronic illness that's different. I mean, have you noticed a difference in kind of the things presenting since then, or has there been no change post-pandemic?
In the Christ Clinic patient population, it's harder to see that trend because when patients do come to see us, they're very sick. So if we're looking at trends, our data would already be skewed in comparison to the general population. Right. So we're already seeing like the sickest of the sick. I will tell you, in my personal life, I've had so many conversations with people lately that are like, all across the religious to non-religious spectrum, all across the political spectrum. And I've just heard so many people say that they feel like something big is coming, that something has changed and something big is coming. And I'm hearing it from people that I feel like wouldn't normally say things like that. And so, from a Christ Clinic standpoint, I can't give you any data that says that we've seen some concrete changes and trends, but there's just something inside me and inside many of the people that I talk to that just says that something doesn't feel the same as it did,
Does that feeling of it not being the same kind of relate to like that dynamic between provider and patient, like the mistrust issue, or is it more,
they're going to drop pandemic X, disease X on us tomorrow through some other means. I hear all kinds of things just like you do.
Yeah. I mean, I don't know. I think for different audiences, like when I'm having this conversation with different people, it probably means different things. I think for some religious people, maybe it has some religious background or feelings. And I think from, in just the general public, if I'm having a political conversation, I've definitely heard people say things like that they're fearful of kind of what is coming next. I think on some level, some of that is like a PTSD on some level.
Yeah. I mean, it was a global collective trauma, really our first global collective trauma.
Mm-hmm. Right. Yeah, absolutely.
Yeah, not a secondary, but a global primary trauma.
Yeah. Mm-hmm. And from our patients, it's interesting because I feel like we're seeing like both in not as many in the middle of the spectrum, but more like both ends of the spectrum. So we're either seeing people that are completely mistrust, like there's just very little trust between us and them, or we're seeing people that are drawing closer. Right. That are like, I want to know more. I want to be closer. I want to understand and developing stronger relationships and deeper relationships with us.
That's awesome. I love hearing about the deepening of relationships. I love how you can see the differences in reaction to people to what has been going on. Yeah. How do we support the work that you're doing? I mean, how do you find the volunteer doctors? Who else do you have staff or the staff volunteers also? Like, how does that work on a community basis? So we do have staff. We have about 25 staff members. So some of those are full-time, some are part-time. And they support the work that the volunteers do. And our patient panel is much larger than the number of full-time equivalent volunteer providers we have. And so the way we're able to do that is by staffing some people that can, keep up with patients in between provider visits. We have a website. It's Christ Clinic Katy, like Katy, like the city.org. And any kind of way you would want to be connected to us, you can initiate from there. But most of our volunteers happen through peer-to-peer recruitment. But definitely we get people that just come across our website or hear a podcast or something like that and reach out and say, I'm interested, or they've been volunteering where they were before and they've relocated and they're looking to re-engage in a new area. But we love volunteers, and we don't just take medical volunteers, non-medical volunteers. We have plenty of jobs for those people too. And then financial support and prayer is another big one for us. It's definitely an uncertain time for us right now. It's, I think about the story when Jesus is on the boat with the disciples and he's in the storm and he called these disciples out on into this storm as a show of faith, right? And for them to understand who's in control and who is all powerful. And I think that right now Christ Clinic is in a storm with our patients. And so we know that a display of glory and faith is coming, but it's hard to be out there in open ocean. Yeah, it's hard to be out there in open ocean. That untethered feeling isn't pleasant at all.
Yeah, for sure.
I love so much how you guys really have a patient-centered care. And a lot of times the low-income people that come through us, they talk tales of discrimination, tales of being fired by their Medicaid provider. And you guys do none of that. Like, how are you able to stay so different? Is it because you are a charitable organization and not connected to the insurance model? Is that the issue for those other providers?
I think that's a huge part of it. And I think that our culture is just the other part of it. I think it's our why. And we have staff members and volunteers that aren't Christian, but we still have our culture is very much built on our why being that Jesus loves us, and he is, and because of that, he's put us here to show his love to others through our actions. And so I think that's really what keeps us, holding our feet to the fire and keeps us doing things differently than the way that they're done other places. And we do patient satisfaction surveys twice a year, and we do quality metrics and all kinds of stuff like that. And we know that our quality metrics are exceed the local, state, national averages for Medicare and Medicaid. Like the quality of care that happens here is great, and I would put our medical team up against any medical team. But what's really cool is when we do the patient satisfaction surveys, I can't tell you how many times we hear the word humane in our surveys, where patients said that they were treated humanely. Yeah. And that's like such a compliment, but also so sad, right? Because that means that they've been places where
treated
they felt like
inhumanely.
They weren't like a human.
Yeah.
It's wild to me I can't imagine, actually. It's really sad.
Yeah, part of that breakdown of trust. I hear those stories that I have a hard time really accepting, because they're so inhumane.
Yeah.
And it's hard to imagine, because I have, just like you, so many people that are healthcare providers that I'm close to, and it's hard to imagine that those others have fallen so far afield from the mission of servitude that healthcare really is. So I remember from my tour, you guys had even like a pharmacy attached. I mean, tell us more about the services that you provide, because you really do have a very unique and glorious center down there in Katy.
Thank you. Yeah, we do have a pharmacy. We have a Class A pharmacy, which means that we can fill drugs for anyone. You don't have to be our patient. And our prices are usually just a little bit under the price point of GoodRx. Some of the drugs we can get a lot less expensive because we are a charitable pharmacy. And then we do primary care. So like anything that you would get at your primary care doctor, we do here. So preventative care, chronic disease management, sick care, stuff like that. But then we also have about 10 different specialty areas. So if patients, if somebody comes to see us and they need to see a cardiologist, then we're able to do that in-house instead of sending them to the emergency room, is honestly what happens to most uninsured patients. Yeah. And we partner with the local healthcare systems to access different kinds of diagnostics that our patients wouldn't be able to afford, so that we can keep the care inside our walls a little bit longer without.
Can you give me an example of what that would be?
Sure, yeah. So like Methodist Hospital System is a great partner for us, and they give us in-kind diagnostics and labs. So if we have a patient that what they really need is an echo, if we really need to look at the chart at the heart and see how it's performing, how well it's functioning, then we can have that scan done and on an outpatient setting that our patient would never be able to afford, but it allows our cardiologist to tailor the treatment regimen instead of having to send them to the emergency room to get an echo. Which is,
so much more.
An echo is, maybe $500, but an average cost of the emergency room visit is, between $900 and $2,000, depending on the type of visit in the emergency room.
Just to walk in the door and sign in.
Right. Yeah. So it's much better for everybody, for the patient, the system, to be able to do that outside and let us continue their care.
Have you gotten any pushback from the medical community at large for the work that you're doing, or for honoring informed consent at the level that I know that you do?
No, really. Maybe we're, I think that we probably have some divine protections here. And so that could be part of why we don't get as much pushback, right? But I think that for the most part, the providers that are attracted to Christ Clinic and the systems that are attracted to Christ Clinic love what we do, and they know that there's something unique about what we do, and that there is a need for it. And I like to use the analogy of like the healthcare system at large is like a battleship, and we're like this little tugboat, right? And so when I say we're grassroots, it's like we're just running around and plugging holes and gaps around this huge battleship of a system in a way that works for patients. And I think any hospital system or physician or anybody like that is going to appreciate somebody in their community is doing that.
Absolutely. It's so necessary. How did you guys get this idea to begin to make Christ Clinic? I mean, I believe it started as a church outreach program.
It did. Yeah, it was started in a church, with one parish nurse and a volunteer doctor, and they saw a need. So people kept coming to the church saying they needed help with medical services. And so they just started seeing patients in their gymnasium. They would do it one evening a month and tear down clinic. And then as it grew, it got bigger than what they could set up and tear down once a month. And so they decided to get its own location. It opened 3 days a week. And it's just, like I said, really been organic growth from that point. But we're 23 years old now, going on 24 years.
Oh, wow.
So its growth has been steady, and there's been good support around it. And there's always, I think the hardest part is that there is always more need than what we can meet alone. I mean, every day there's patients that we have to turn away that we can't see, which is hard and sad. And, we feel bad for doing that, but there's not enough resources. And so we definitely need help to be able to continue to meet the need.
To see everybody that's there.
Yeah.
No, I agree. I mean, the center that they have down there in Katy, I've never quite seen anything quite like it. I've been to lots of different, lower income focused clinics, but they have a really comprehensive, space where they do everything from long-term wound care, which is usually a big drain on the hospital system. The underinsured will have to go to emergency rooms or go in with infections because they're not getting proper wound care for long-term things. I think it's amazing you even had like an optometry room set in there to look at people's eyesight and vision, which is something great. I mean, do you guys offer like prenatal or pediatric services, or do you have somewhere that you send out for those? Like, what do you do for like the young families?
So we don't see that many pediatrics because we don't take Medicaid or CHIP. And so usually the lower income families have access to those. And so they go somewhere else. But we are seeing that gap is increasing a little bit. We are seeing more families that have too much money for Medicaid or CHIP, but still not enough money to afford healthcare. So we're seeing more pediatric patients. As far as OBGYN or obstetrics, pregnant women, we diagnose a lot of pregnancies, and then we work with different providers in the area. We'll work with like Pregnancy Help Center, or we have several medical doctors that volunteer with us that we can refer patients to even before they have their Medicaid. And then that doctor's office will help them to get their Medicaid, but they'll see them in the meantime so that they're not going without prenatal care.
That's wonderful.
Yeah.
It's
great. You asked we were talking about us getting started in a church, and one of the things that we started doing recently is opening satellite clinics in other churches in our community, because one of the great things that happened when we were in the church is, the number of, the phrase, it takes a village, right? The number of people that were available to help in the ratio of those people in comparison to the people that needed help looked much different than it does in a setting like we're in now, where we look and act and run like a medical clinic. And I think that there is really something beautiful about the relationships that happen when there's other people in the church. Even if the person is not interested in engaging in a spiritual relationship, which of course that would be our desire, right? That we want them to feel the love of Jesus through us and want to give their life to him. But even if that's not what they want, there are a lot of Christians around the world that certainly in Katy, that want to help people no matter what their beliefs are. They just want to help them because they believe that's what they were called to do. So by pulling them into a church community when they need stuff like, well, I don't have transportation, and so I need rides to my doctor's appointments, or I don't have a way to get to the grocery store, so I can't get healthy food, or, I need to, I don't have electricity, and so I can't keep my insulin cold, or I don't have a working refrigerator. Like, those are the kind of things that churches do amazing. And so I think, us strengthening our relationships with churches is going to make something even more beautiful happen than what you got to see when you were here last time.
Awesome. I think that's great.
I just love hearing from healthcare providers like you who are honoring informed consent and still view themselves as being in partnership with the patient rather than feeling that dynamic that they know best and that the patient's only obligation is compliance.
Yep.
I love how you discovered the best way towards compliance is through understanding with the patient.
Oh yeah.
Yep.
Yeah, absolutely. And we see patients from a lot of different cultures too, right? So
Yep.
so you really do have to understand patients' perspective and especially as a Christian, I think this should be true for all humans, but as a Christian, I certainly don't think that I am or my way is any better than anyone else's, right? So, I think that if we don't take the time to understand what their way is or what they believe and what they want, then we'll never build a good relationship with them, and they're probably not going to be compliant with their medical care either because they
don't understand it.
Yeah. Mm-hmm.
Yeah.
And you really do come across some really beautiful beliefs and practices that have worked for thousands of years in other places, so it doesn't make them less than our way. It's just not our learned way at this point.
Right. I love that perspective. I love that you see the beauty in the differences. Yeah. So for those of you who are listening who want to learn more about this incredible organization or to volunteer either as a physician or as a non-medical volunteer, or if you want to contribute to them in some other way, you can find them online at christclinickaty.org. Is that correct?
That's correct.
And definitely feel free to check them out. I had a wonderful time during my visit, and I'm looking forward to future partnerships where I can help them with some of their informed consent practices at will, and to just kind of continue to appreciate how this shift is happening from the ground up in the medical community, how there are still so many wonderful providers like here at Christ Clinic who really are practicing patient-centered care and are ready, willing, and able to partner with you for your best health outcomes. I'm so appreciative of you, Laura, taking the time. I know how busy you are down there during the day. I know we had some technical difficulties, but I'm so grateful that you were able to hop on and educate us about this wonderful clinic that you're running down there, and helping us more fully understand who you serve and how we can get in touch with you.
Thank you for having me. I appreciate it. And we love giving tours. So sign up for a tour and we'd love to show you around.
Thank you so much.
Thank you.
We'll see you next time on Shot Callers.
Thank you for listening to the Shot Callers podcast. Please, if you found value in this content, rate us and share the podcast with a friend. It's a great way to get the message out and to empower everyone to make informed decisions. Until next time, never forget, we are the Shot Callers.